huge issue for us. An amazing consumption of effort, labor costs, and work for both physicians, our allied health professional PANPs, and staff. Massive amount of work, and partially it seems to be that roadblocks or speed bumps are being put in the way for newer therapies, and we know the newer therapies have more cost with them, but the innovation is really quite remarkable in terms of impact on the disease. So, but it is an absolutely huge issue in the field. We're facing it right now with our newer non-steroidal agents because there's been a lot of movement in even the last few months with approval of two new products down to age 2. And we'll have some payers where if we write any non-steroidal, they send us a list. You have to use these agents, and it's a list of 40 topical steroids. So it's like, yeah, we know what the topical steroids are, but we're now looking for a non-steroid because we're having problems with the topical steroids, either underutilization or concern about side effects. You can't use them. You can't use them for 4 weeks in a row, right? You're not supposed to. That the new non-steroids you can use for a year or off and on. They have a liberalness to them that can allow long-term disease control that you might not be able to get with intermittent topical steroids. So there's no question that that we have a lot of issues with that, and we don't have a lot of specific pediatric data, and the decision making isn't necessarily looking at the life of the impact of eczema on those individuals starting early. There's just one policy that says we're not going to approve this, so you need to go through these 3 other agents before we might consider it.